This aircraft brought the first sign of good news for millions of Iranians since the start of the pandemic nearly a year ago. The Russian Sputnik vaccines are the first batch to arrive, and there are 2 more shipments coming later this month. These jabs will be given to 430,000 healthcare workers before anyone else, and Iran has so far purchased 2 million doses of the Russian vaccine.
Russia's Sputnik V's efficacy is 91 to 93%. Considering that the Sputnik is designed well and its second doses are stronger than the first doses, we expect 91 to 92% efficacy in our country. More importantly, the Sputnik V prevents death in very serious cases of the disease 100%.
Iran is the worst affected country in the Middle East, with nearly 60,000 COVID-19 deaths and more than 1.4 million people infected. This shipment comes at a critical time when the country is trying to avoid another wave ahead of the Iranian New Year in mid-March. That's a time when families visit each other in large numbers. President Hassan Rouhani has warned Iran cannot afford another lockdown, and he's urging the public to continue to observe protocols set out by health officials. Iranian scientists have also been working on their own vaccine, 2 of which are now in human trial phases, and officials are hopeful they will be rolled out in the next few months. Despite severe economic sanctions on Iran's banking sectors, officials say they have purchased 18 million doses of foreign vaccines, but not those made in the US or Britain. Supreme Leader Ayatollah Ali Khamenei has banned the import of vaccines made in those countries, saying they cannot be trusted.
On Thursday, Iran recorded 67 deaths. That's the lowest number in the past 8 months. But there's still a long way to go before the officials here are able to vaccinate a large number of people. They're hoping that they will be able to do that by the beginning of next year, mid-2022. That's when they hope there will be some relief for the millions of Iranians that have been affected by this pandemic.
Dorsa, thanks very much. Dorsa Jabari reporting live there from Tehran. Nadeem Barber joins us live here on the NewsHour from St Thomas's Hospital in London. So, Nadeem, they're going to try mixing different vaccines. How do they know if it works?
Well, to be honest, they don't know as yet. I'm actually at Guy's Hospital in London, where they're already vaccinating some of the local population. But the government are now saying that they're going to work with Oxford University in a world-first trial. They want over 800 volunteers, aged more than 50, people who haven't had a jab, and they're going to give them a first dose of either the Oxford AstraZeneca vaccination or the Pfizer BioNTech vaccination, and then they'll get a second one within 12 weeks. That could be the same, or it could be an alternative vaccination. So they want to find out whether protection is actually worse, the same, or even better if you get a mixture of vaccines. They're saying that other vaccines could be involved, such as the Novavax and the Janssen vaccines, once they're approved as well. And the scientists in this study are hoping that it could give them clues as to how to fight better against those variants as well, which have emerged not just here, but in South Africa and Brazil.
But this plan won't have a negative impact on the vaccine rollout in the UK anyway, which is going really quite well, especially compared to some other European countries.
That's a fair point, Peter. Britain really is being seen as an example by many countries in Europe. It's got more than 11 million people, I think, vaccinated as of now. It's on plan to get the first 4 priority groups done with their first dose by the middle of the month. But Nadeem Zahawi, the government minister for vaccines, has said that there are globally 4,000 roughly variants of the virus. And for that reason, scientists here are putting together what he's called a library of these mutations so that they can be ready to react to any developments in future. He's pointed out that people like Pfizer BioNTech are already trying to adapt existing vaccines to be ready to adapt to any mutations. He's also warned that he's worried that although 85% of the population here say they will get the vaccine, the rest, the 15%, is skewed towards people who are in the so-called BAME community, black and minority ethnic groups. And the worrying figure at the moment is that people in Britain who are either black British or African nationality are twice as unlikely, twice less likely to have received the jab so far compared to the white British population. So Nadeem Zahawi says that the government is going to try to get figures from the National Health Service on ethnicity and try to get into local communities to really improve that situation.
Nadeem, thanks very much. Nadeem Barber there reporting live from Guy's Hospital in London.